Good morning. Today we're going to start with Marion actually, and we'll give her update and then come back to me.
Good morning, everyone. Thanks, Dr. Morrison. I first want to just give a huge thank you to all the staff and physicians who worked hard over this past weekend to move our Charlottetown testing clinic and cough and fever clinic from the Eastlink Center to its new location at 64 Park Street in Charlottetown. It was a monumental effort done while continuing our testing services in the meantime. I also want to thank the Eastlink Center leadership, their staff, security, and everyone who made the operations at the Eastlink Center a success over these past 6 months. We couldn't have done it without the support of that staff, and I've heard many times from our Health P.E.I. staff at that site of how helpful the Eastlink Center staff have been. The new Charlottetown Park Street COVID clinic has been running since yesterday morning. The clinic continues to offer scheduled appointments for testing, as well as cough and fever assessment clinics, and our drop-in unscheduled testing clinic for anyone with symptoms. We continue to assess the needs for testing now and in the coming weeks and months, and this will continue depending on the requirements as are directed by the Chief Public Health Office. We know large-scale testing will continue to be important for a long time, and we are actively working to expand our hours for testing clinics across the province. Due to a recent increase in demand for testing, we have increased the Charlottetown Park Street COVID drop-in testing to 7 days a week, adding a Sunday to that schedule, as well as some scheduled appointments on that Sunday. The Slemon Park COVID clinic will also now be open for 7 days a week, adding Saturday for drop-in testing clinics either in the morning or the afternoon. All up-to-date information on our COVID clinics for testing and assessment is available on the Government of P.E.I. COVID website. In addition to the move and adding additional testing, the clinics have continued to be busy. Yesterday, 506 tests were completed at the clinics all across the province. Negative results continue to be available on the negative testing website through the government web, and we have heard that people are receiving these results quickly, which is excellent and a credit really to the great work of our testing clinic staff and laboratory staff. Depending on the volume of tests, it's just a reminder that results may take up to 72 hours after being tested to be posted to that site, and those results are available for anyone with a Health P.E.I. card, and you can log in and access your results online. Thank you once again to all Islanders who are following the COVID-19 precautions. As we watch the implications when community spread is present in other provinces, we're grateful for everyone's collective effort here on Prince Edward Island. It is making a real difference. Again, thank you to our staff and physicians who are making this response possible. And as always, please attend your appointments, seek care if you need it, bring and wear a mask to all of our Health P.E.I. services. Thank you.
Thank you, Marion. Today, there is one new case of COVID-19 to report in Prince Edward Island. The case is a male in his 20s, a worker who traveled outside of the Atlantic bubble. He's an island resident, and no air travel was involved. I spoke to him this morning. He's well and at home, and further contact information and contact tracing has been initiated. So in total, we have 2 active cases in the province, and since the pandemic began, we've had a total of 59 cases and no hospitalizations or deaths, and all of our cases have been related to travel outside the bubble. It is concerning to hear about the sharp rise in cases being reported by many provinces in Canada. It is normal for us to feel very protected here in Prince Edward Island, being part of the Atlantic bubble that to date has been very safe. We are reminded regularly, though, that COVID-19 is highly contagious and a virus that likes to move and move quickly. Learning to live with COVID-19 has not been easy. However, we can take comfort in knowing that we can do mostly everything we did pre-COVID with some modifications now here in this province. And while we are hearing about targeted lockdowns in some parts of the country and restrictions being imposed in other provinces and countries, P.E.I. is in an enviable position of slowly and carefully getting back to what we are calling our new normal. We are moving to a new normal phase of a Renew P.E.I. Together plan on Thursday, October 1st. And the new normal phase reflects how we will live with COVID-19 until there's a safe and accessible vaccine or an effective treatment for the virus. This phase will allow for increased gathering limits, relaxed visitation guidelines in long-term care, reinstatement of public services, and increased opportunity for regular sport and recreational activities. And there are more details about the new normal on the website. And we can move towards easing restrictions because Islanders have worked together to protect themselves and one another. We have learned that basic public health measures are effective in containing the spread of COVID-19, and these will continue. Physical distancing, frequent hand washing, cough etiquette, staying at home when you are sick, and keeping a circle of contacts small, and wearing a non-medical mask or face covering when in indoor spaces. These measures are all layers and must be applied together to protect all of us against COVID-19. We do not want to have new cases of COVID-19 in P.E.I. However, when cases do get introduced, these measures will help limit the spread within our communities. It is our behaviors that determine how the virus moves about our province. Unfortunately, we have seen in P.E.I. and other jurisdictions when individuals decide to ignore the rules and, for example, have large gatherings where physical distancing is ignored, they place themselves and the community at risk. An important element of our planning to ease measures as part of the new normal and reopen our economy is the development of a three-phase alert system to guide decision-making regarding the risk of COVID-19. Effective October 1st, we will be in a green phase, or the new normal. And there are two other phases, yellow being the cautious phase and red being the most restrictive. We asked ourselves, what are the most important considerations when deciding to ease restrictions or conversely to impose restrictions? There's no one single indicator or factor used to determine our risk level or public health response. However, there are key factors to consider. The core criteria include COVID-19 transmission is controlled, the number of cases, hospital and ICU admissions, deaths. We have sufficient public health capacity, which includes case detection, contact tracing, testing, and isolation. We have sufficient health system capacity, including critical care capacity and personal protective equipment. And outbreak risk in vulnerable settings is minimized, for instance, long-term care and corrections. And the risk of importation of COVID-19 is managed. Border measures and screening and self-isolation are a big part of that risk of importation. Decisions about moving between the green, yellow, and red phases will be guided by these core criteria, as well as balancing the impact to Islanders and communities with the risk of transmission of COVID-19. We hope to remain in the new normal phase for the foreseeable future, protecting our most vulnerable citizens, containing small clusters or outbreaks, and limiting community transmission. While it is not what we want to do, we have to be prepared to tighten restrictions if necessary and adjust or reverse some of our public health rules. And more information on the P.E.I. COVID-19 alert system will be available on the website today. Last week, I spoke about upcoming changes to isolation and testing protocols for island workers who travel outside Atlantic Canada and for individuals who travel to P.E.I. for work from outside the region. And we recognize that some island residents who travel outside the Atlantic bubble for work must go back to the workplace when they return to P.E.I. We also appreciate that in order for our economy to function, it is important that Islanders be able to return to work, and we want to support them through this process. Over the past number of weeks, the need to clarify isolation and testing requirements has become obvious. Some of the messages and advice has been difficult to understand and has resulted in some individuals unintentionally not following the guidelines. In other cases, individuals are deciding not to isolate and or be tested as they should be. Islanders should be concerned about individuals who are deciding to ignore the protocols for isolation and testing after traveling outside the Atlantic bubble. Isolation and testing are key elements in containing the spread of COVID-19. Given that all our cases are related to travel outside the Atlantic bubble, it is critical that we pause and hit restart with some clear guidelines for isolation and testing of workers, especially in light of what we're seeing across the country and across the world with increasing cases. So going forward, there will be 3 groups of workers. The first is healthcare workers. The second is rotational workers, and these are P.E.I. residents who travel routinely outside the Atlantic bubble, but within Canada on a set schedule and spend at least 50% of their time away from P.E.I. And the third group of workers is really all other workers. For rotational workers, there are some, these are really special circumstances to allow them to spend time with their family for the limited amount of time they are home. And we've spoken about that before. And for other island workers who return home from outside the Atlantic bubble, the preferred option is for them to self-isolate for 14 days and work from home. But if it is not possible for island workers to self-isolate because the need to return to work here, they can apply to work isolate with the employer's support, provided they maintain physical distancing, wear a non-medical mask, practice good hand hygiene, and monitor for symptoms when they are at work. But when they are not at work, they must self-isolate at home. Individuals approved for work isolation will be subject to testing at regular intervals. Allowing islanders who must return to their workplace to work isolate requires careful balancing an acceptable risk of transmission with the need for individuals to work. A question and answer and an online declaration form that must be completed by all workers returning to P.E.I. who want to be approved for work isolation will be available later this week, and these changes will come into effect Friday, October the 2nd. I've been asked to clarify some information that's related to schools. And it's around testing and symptoms. So students and staff should remain home when they are ill so that illness is not spread through schools and workplaces. If a student or staff has tested negative for COVID-19 but still displays mild symptoms, please consider the following. Students and staff should not return to school or work, even if they have a negative test, if they have ongoing fever or chills, if they're not well enough to fully engage in learning or their job, if the symptoms are not improving or there are new symptoms. But students and staff could return to work if they are fever-free for 24 hours without the use of fever-reducing medication, or if they have really mild symptoms like runny nose, where they can return to school provided they are well enough to engage in learning and their job. And if their symptoms are improving and there are no new symptoms, and they continue to practice good hand hygiene and cough and sneeze etiquette. As well related to school, now that school has reopened, there continue to be questions about what will happen if there is a positive case in a school setting. The school outbreak response guidance has been posted on the website. And if there is a positive case, public health will move quickly to conduct contact tracing and testing. Public health staff are available 7 days a week, and they have already shown with public health nursing and health P.E.I. that we will initiate contact tracing and testing very quickly. A single positive case of COVID-19 in a school will not necessarily mean that the school will automatically be closed, but school closures will be decided on a case-by-case basis by the Chief Public Health Office in consultation with the school administration based on risk to students, staff, and teachers. And if it is deemed necessary to close a school due to an outbreak or case, it could be closed for 1 or 2 days, but up to 28 days in light of an outbreak, which would be 2 or more cases. There is real concern that our system could be overwhelmed with a second wave of COVID-19 during the influenza season. A typical influenza season demands a lot of our health system, and we can lessen that by getting vaccinated for influenza. We are in the midst of a global pandemic, so it's more important than ever that Islanders protect themselves and their loved ones from seasonal influenza. So I urge Islanders to get a flu shot to protect themselves from reduce the chances of getting influenza, but also the complications related to influenza. It is available free of charge at public health clinics, pharmacies, nurse practitioners' offices, and physician offices. And certainly the pharmacies are available, but also if you call 1-844-975-3303 or visit the provincial website for more information on the flu vaccine clinics. I recommend that everyone over the age of 6 months gets the flu shot. It's especially important for those with a weakened immune system, young children, residents of long-term care facilities, pregnant women, healthcare workers, and those over the age of 65. And this year, and I know we've mentioned it before, high-dose influenza vaccine will be available for all individuals over the age of 65. And I encourage Islanders to keep up with the COVID-19 public health measures that we continue to talk about, like physical distancing, hand washing, because following these steps will also reduce your risk of getting influenza. Last week marked 200 days since the World Health Organization declared the COVID-19 outbreak as a pandemic. No one could have predicted that we would be at this point 200 days later. In fact, many would have speculated that it would be over by this time. And we now know that we are dealing with COVID-19 for the long haul. I want to thank all Islanders for their support and cooperation. We mentioned earlier a second wave of COVID-19, and we hear discussion about this across the country, doesn't happen by itself. It happens as a result of human behavior. So it's only by us working together collectively, individuals, businesses, industry, and communities, public health, and the healthcare system, that we will be successful in containing and mitigating the impacts of this virus. As we continue this journey together, please remember to be patient and to be kind. Thank you. And we'll open it up for questions.
Carrie Campbell, CBC.
Good afternoon. Thanks for the opportunity. I just wonder if you could, first of all, give us some more details around the circumstances of the new case that you announced today, when that young man arrived. Did he self-isolate? Was this a person who was allowed to work isolate? Was it found through routine testing? Were they symptomatic? And how many contacts are you tracing? Sorry, there's a lot in there.
Hi, Carrie. So literally the case, we found out about the case just before coming here. So a lot of those details will we're going to learn more about. My understanding is that this individual returned to the province the middle of last week, so 6 days ago, initially had symptoms and but is well and is at home now without symptoms. And it's certainly by initial conversation, I believe has had minimal contact with anyone else and indicated he self-isolated, but we are following that up and will be doing any testing of any close contacts.
Okay, well, we'll try to get some more info on that maybe later through email. Another thing I would love to ask you about is just you announced this new three-phase program of openings and closings, and I guess kind of the new normal that comes in on October 1st would be, I guess that's the green phase. Just wondering if you can kind of walk us through a little bit, what do the yellow and red phases look like in terms of what further restrictions we might see, and then just I wonder if you can comment as to why you decided to move to this kind of system.
So, Carrie, I mean, we've moved through multiple phases in our reopening, and that reopening really has started back in May or earlier. So, and it has been a very sort of stepwise, methodical approach to reopening. But as we and we've always had certain criteria identified, and they're approved through WHO and the Public Health Agency of core criteria to look at what would mean that we should have more restrictions in place. And you see the other provinces doing very similar kinds of things right now in imposing more restrictions in other places. So we felt that this was a good time to, as we get to this next phase of our new normal in this week, to outline for everyone what that looks like. And I mean, we've sort of going into the green phase, but important that people all understand what those criteria are very clearly, and there'll be links to those. Not one single criteria will determine it all, but it's a combination of those criteria, and then what that might look like more restricted. So it's color coordinated, you know, red being more restricted, and then green being more open, and it's really for planning. It's for awareness that some of those measures may need to be restricted at some point. For instance, long-term care visitation. You know, we know that's a very vulnerable group. They would restrictions would be put back in place if we and certain restrictions if we had to move to more if. For instance, there's widespread community transmission. We would want to do that very quickly. Some of the restrictions that we might want to look at would be on gathering sizes, and what that looks like. And again, I hope we don't have to do that, but I remain, I guess, cautiously optimistic, but very aware of what's going on around the country.
Thank you very much.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you both. Bonjour, Dr. Morrison. Peut-être en français, m'expliquer pourquoi vous avez fait le choix de passer à un système de couleurs vert, jaune et rouge, et m'expliquer aussi en français qu'est-ce que ça prendrait, quelle situation à laquelle on devrait faire face pour qu'on passe d'une phase à l'autre dans ce cas-là.
Alors, bonjour. Alors, c'est vraiment de mettre sur une table pour tout le monde qui peut voir les choses qu'on pense à propos, quand on fait une décision à propos de faire plus de restrictions. Et puis, je pense que c'est peut-être plus clair pour les insulaires de voir qu'on est on commence une phase verte, qui est presque, on peut faire beaucoup de choses avec des restrictions, mais encore là, on peut jouer les sports, on peut aller manger au resto, on peut aller à l'église, on peut faire les visites. Mais si on a besoin, on va faire plus de restrictions. Alors, on regarde les nombres de cas, si on a beaucoup d'admissions à l'hôpital, si on a des morts. On regarde si on a on a la capacité de faire les contact tracing, faire les tests. On regarde si on a assez de capacité à l'hôpital, aux soins intensifs. On regarde si on minimise le risque pour l'entrée de COVID-19, alors les mesures au point d'entrée à l'île du Prince-Édouard, si les personnes restent mal dans une pandémie, mais à un moment donné, on peut faire encore des restrictions pour protéger les insulaires. C'est le but de protéger le plus grand nombre de personnes ici que possible.
Merci beaucoup.
Merci.
Sally Pitt, CBC.
Hi, Dr. Morrison. I'm just wondering, I could make out the gist of most of what you were saying there. I'm just wondering if there's anything additional that you said in French that we need to know about in English. If you could translate it into English, please.
Okay. A lot of it was really a repeat of what I said to the first question, but I mean, I think the thing I added was, as we go through and into this new normal, really the goal is to try to always keep in mind that we want to protect islanders. And we ask ourselves every day, are we doing everything we can? So if we are worried about trying to protect islanders, we need to put some restrictions in place. We'll do so quickly to try to protect everyone as best we can. And so that's just, it's a reminder really that although I hope we don't have to do that, we may need to, and the rationale for it and the criteria that we are going to be thinking about are well laid out, and we'll and if we need to, the reason we would do it is so that we can protect islanders.
Okay, thanks very much for that. If I could get to my questions now. We've read media reports in recent days that you've received some threats in your role as Chief Public Health Officer. Could you tell us a little bit about the circumstances of those, how they were relayed to you, what were people upset about?
Well, Sally, I think, first of all, in the last number of months have been challenging for everyone. They've been challenging for all islanders, and we've had to make difficult decisions in order to try to protect everyone here. And they're not always decisions that are easy for people. They're not always popular decisions, and they have impacts. And I think when you couple that with fear and anxiety in the middle of a pandemic, some people react to that. But overwhelmingly, people have been very positive, and we've said it week after week here. Islanders look out for each other. They want to look after their families and their community, and that has been overwhelming the response. So, and I certainly can understand that there are some people who have not been happy, and they have expressed that.
Can you kind of quantify it and let us know if the threats have been so serious that you've had to contact authorities or take any additional precautions?
I mean, I think anytime there is any concern about threats, there's a process in place here in government. I don't think it's something that I want to focus on. I want to focus on the positive response and support. But I do think anytime there's a threat of any kind, it certainly can be upsetting for staff, for my family or me personally, but that has, I mean, it's been, really want to focus on the positive and not dwell on any of those potential, any threats that may have come.
Okay, thank you.
Allison Jenkins, The Guardian.
Yes, hello. I have a question for Marion Dowling. First off, what's behind the extra demand for testing at the testing clinic?
Hi, Allison. Well, I think it's really about the increase in contact that we're seeing by opening up some of the measures. Students are in cohorts. There are other viruses that are out in our community that are being spread to some extent. Obviously, we've been lucky that it isn't COVID related, the majority of our testing. But when people are concerned because they do have symptoms, they are seeking testing, which is what we want. That's why we have the testing services in place, is for people who have symptoms to be tested. And Dr. Morrison can speak to this, but really tracing and very quickly being able to trace any new positive cases is what we want to support with our system in the response. So I can't really speak to it other than we've definitely seen an increase in symptomatic testing. That's been happening over the past couple of weeks, and I think we've seen that in other jurisdictions as well. But that's really what it has come down to, and we want to increase the access now that schools are open, students are gathering, sports are starting, gatherings are in higher numbers and will be coming into that. So we want to make sure people have access to testing quickly so they can continue to find their results, go back to work, go back to school when they are well, and have some comfort in knowing whether or not they are protecting one another in their communities. And that's what people are coming forward to do with symptoms.
Excellent, thank you very much. And my next question, it's been discussed like in French and English, but I just wanted a bit more clarity on the 4 keys that you had mentioned for moving back and forth between the color phases. I heard 5, including border measures, but I just wanted to go through those again and see kind of the key measures again.
We actually often talk about 7 key criteria, but I've listed 5 here, and they sort of have been grouped so that COVID-19 transmission is controlled is 1, and that includes your number of cases, hospital and ICU admissions, and deaths. Number 2 is the sufficient public health capacity, which is your case detection, contact tracing, testing, and isolation. Number 3 is our sufficient health system capacity, which is including our critical care capacity and personal protective equipment. And the 4th I've listed here is outbreak risk in vulnerable settings is minimized, which include, for example, long-term care and corrections. And the 5th one I have listed here is the risk of importation of COVID-19 is managed. And that is our border measures and screening and self-isolation requirements that are in place. And Alison, we have that. They are all outlined in quite a bit of detail, and I believe I was told that this will be able to go up on the website. And it may be active now or early this afternoon.
Fantastic. I had heard 4, and then you had listed 5, so it was just my mistake there. Thank you so much.
Laurent Rigaud, La Voix Académie.
Good afternoon to you both. Dr. Morrison, bonjour. J'avais une question en français pour vous concernant la nouvelle normalité et dans laquelle on rentre le 1er octobre. Est-ce que cette phase va durer jusqu'à ce qu'on ait un vaccin? Est-ce que maintenant c'est la dernière phase et on attend qu'il y ait un vaccin pour aller de l'avant?
Laurent, c'est une bonne question. Je pense que oui. mais on a peut-être d'autres facteurs qui vont influencer, mais à ce moment, qu'on pense que c'est la nouvelle normalité jusqu'au temps qu'on a un vaccin ou un traitement possible pour le COVID-19. Mais on fait les ajustements, on s'organise si on a de nouveaux infos. Peut-être ça va changer si on change de capacité pour les tests ou non. On a d'autres manières de faire les tests peut-être. Mais à ce moment, en général, on veut être là pour protéger tout le monde, mais ça va aussi dépendre un peu qu'est-ce qui arrive avec les frontières internationales. On va garder ça aussi.
D'accord, juste un follow-up sur cette question. Donc, ça veut dire que tant que la situation au Canada reste comme elle est, ça, ce sera la situation à l'île du Prince-Édouard. Si maintenant, au Canada, ça va mieux dans les mois qui viennent, mais qu'il n'y a pas encore de vaccin, vous pourrez rediscuter et voir comment on adapte la situation. C'est bien ça?
Oui, exactement.
Très bien, merci beaucoup.
I think that's it, so thank you very much.